pleased to be joined by Donald Parker, who is president and CEO of Carrier Clinic. Good to see you.
Hey, Steve.
For those who don't know Carrier Clinic, it is
the oldest private psychiatric hospital in New Jersey. We're 109 years old. We're also the largest psychiatric hospital, private psychiatric hospital in New Jersey, and the fourth largest in the country.
And as we speak, toward the end of 2018, there's a bit of a merger taking place. Describe it.
Well, we are really blessed with the opportunity to join the Hackensack Meridian Health System. We are now pending Attorney General approval. We expect within the next month we'll receive that, and we will then combine our organizations as of the beginning of the year.
Now, talk about behavioral health. First of all, define behavioral health, then let's talk about the future of it as you see it.
Well, Steve, many people have many definitions of behavioral health, and in our organization, we really look at the malfunctioning of the brain, and that can happen in a variety of different ways, either through psychiatric illnesses or addiction. Both of them have genetic basis. They're both diseases, so we treat them like that. We don't really look at it on a social basis, although we do a lot of work with our patients around social issues, but they're diseases. And the fact that they haven't been treated as diseases has left us where we are today, and we're way behind all our other areas of the body, all other organs.
We're behind.
We're way behind.
Define behind.
Well, think about the comparison of polio, 1955. 1,500 people died. That was an epidemic. Today, 72,000 people died last year from substance abuse. You would think we would have some cures for that, and we are failing. It went up from 63,000 in the year prior to this. So it's an unusual epidemic.
Don, all the talk about the opioid crisis, isn't there is there a clear correlation between the opioid crisis and behavioral health issues? And people say, hey, this is the larger piece of the pie that we need to be dealing with, or is this another political, I hate to say this, another press conference by a political or elected official, hey, that's my number one issue. Well, isn't it a behavioral health issue?
It's a behavioral health issue, and while we have separate treatment modalities, we also intersect in a lot of different ways on how we treat patients. And all of our treatment methodologies today are lacking the science behind them. We have medication behind them, but in terms of the science that's necessary really to respond to the kind of epidemic we're dealing with.
So your organization has been around a long time, solid reputation. This merger will mean what from your perspective in terms of who you will be able to serve and how you will be able to serve them?
Well, Steve, this is a platform. And we've figured out all different kinds of things to deliver from this platform that help you. I suspect that we will have a lot more opportunity to practice science in conjunction with all the scientific activity that's going on in Hackensack Meridian, to have a platform of 17 hospitals, 450 outpatient locations to distribute our product. We expect to have sometime early, I hope, in 2019, a behavioral health urgent care center.
Urgent care center?
Urgent care center.
Define what does that look like?
Well, you've probably visited an urgent care center for physical health, and they're all about being open when nobody else is open, being a price that's lower than going to emergency room, a lot less inconvenience in the emergency room, and care that's on demand, and deliver in really high quality.
You can do that in behavioral health?
We're going to be one of the first in the country to do that in behavioral health. We expect.
Interesting.
So,
is that a cultural shift? By the way, let me just close that Hackensack Meridian Health is one of the many healthcare organizations that are supportive of what we do here in public broadcasting and this particular production company. But I'm going to ask you this about culture. Do you think that's a cultural shift for a lot of us who say like, no, I got a rash, I got a cold, I got this, I'm going to urgent care. I got a behavioral health issue. Who am I calling?
Yeah, I think that people are oftentimes bewildered. There's not a centralized hotline you can call about behavioral health issues. There's hundreds of them, and you don't know what to trust. There is not a place that you can go other than an emergency room to expect to get your behavioral health issues taken care of. Emergency rooms are dealing with all kinds of critical things, and when your illness is not as apparent, you can end up in the back of the line pretty easily. So we believe if we connect it for patients. They'll get quick care, they'll get the right care, and we'll be able to help them move on their
Don't
way.
help me on this. Electroconvulsive therapy, ECT, what is it?
Well, if you ask Jack Nicholson when he was doing One Flew Over the Cuckoo's Nest,
Really?
it would be a pretty gruesome process. Today, it is incredibly effective, efficient, no side effects, and it's done under anesthesia. We do close to 5,000 procedures a year.
Not a lot of controversy about this today?
Not by the patients who come in and receive the treatment from us. Many
the
patients,
benefits?
many patients call it a miracle to have their brain stimulated in a way where they're under anesthesia, and when they wake up, they still have all their memory. There's no side effects, and whatever that we're treating, most often depression, is diminished, and it lasts for a long period of time. We have turned the corner many, many decades ago. It still has a stigma.
Yeah. You know, it's interesting. You mentioned the stigma part. It's got me thinking. You've been in the, I don't want to say a business, you've been in this field for more than, just say a couple of years.
We're like 43.
So you've seen a lot. My question is, to what degree do you believe societal attitudes, stigma-wise, that we're better, significantly better than where we were, just say 10 years ago when it comes to mental health, mental wellness, behavioral health issues? I'll throw them all together for the purpose of the discussion. Go ahead.
Right. Steve, I think that we're turning the corner now. I mean, the very fact that a incredibly successful system like Hackensack Meridian are looking for a partnership with Carrier Clinic is an indication of that. I mean, they want us to be an integral part of all the services that they provide. Because if you go disease by disease, you're going to find some kind of psychiatric issue that impacts it. And whether it's compliance with medication for diabetics or it's cholesterol or you're eating the wrong things, there are always behavioral correlates to it. So we're going to be working together side by side on a lot of issues. So it won't be just behavioral health going in there operating independently. We're integrating it in the Hackensack Meridian
Before
system.
I let you go, people shouldn't suffer silently here, should they?
Well, if you don't step up, you're not going to avail yourself of what you need when you need it. It's only going to get worse. It's like an infection. You don't get the right kind of medication in your system. You don't get the right kind of treatment. You'll succumb to the disease. You will be in a psychiatric hospital. Our job, especially with our new partners at Hackensack, is to get you at early stages, get you in an urgent care center, and be able to help you before you need a hospital.
Don Parker has been doing this for 43
years.
He's president and CEO of Carrier Clinic. As we talked about this new partnership, which will change the landscape of this discussion moving forward. Don, I appreciate you joining us.
Thank you, Steve.
Make sure you keep us updated.
Our pleasure.
We'll be right back, right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, Wells Fargo, St. Peter's University, the North Ward Center, New Jersey Resources, Summit Medical Group, and by Adler Aphasia Center. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.